Welcome to We're at the Age from Voice St. Louis.
This week, we're talking to Voice Program Director Chien Hung. Chien's going to help us answer the question, what is an ombudsman? And more importantly, how they can help residents of long-term care facilities in Missouri and throughout the United States. If you're curious about ombudsman or the role of voice in long-term care, stick around to hear more about it from an expert. Welcome to We're at the Age. I'm Marjorie.
I'm Melody.
And Melody, we're here today. We're talking about ombudsman and advocating in nursing homes, which is part of what Voice does. And I know that all of us came to Voice for different ways and different reasons. And I have this trend with all the places that I work with that eventually I'm going to need the services that I provide. And that's already happened here at Voice. So I mentioned, I think on our first episode, I mentioned my uncle who's aging. And a couple years ago, he had a pretty big health scare and had to spend some time in a long-term care facility as he rehabilitated. And actually, at one point, it looked like he was going to stay there permanently. During that time, he really kind of struggled because he had, it was a big facility. Well, it wasn't that big. It was long. It was a long facility. And they were really understaffed, like so many facilities. And so they couldn't always get to him when they wanted to. And in fact, he had a across-the-hall neighbor who would constantly use their call light, except the call lights in this facility, once you hit them, it just had an alarm that continued until the nurse actually came and turned it off, which was really good for getting people to come. But when people didn't come quickly, it became a real problem for people. Yeah. When he was there, he actually had a fall, which was a pretty big problem. He was on the floor for a while before somebody was able to find him. So, while I was doing that, I thought, man, it would be just so great for, there would be somebody who could come and speak up for him when our family wasn't able to be there. So I guess what I'm saying is that we're at the age where my family needs an advocate.
Definitely. And I know one of the big things we do here at Voice is house the ombudsman for the St. Louis area. So we have with us today Chien, who is over the ombudsman program. Tim, can you tell us a little bit about your role here at Voice?
Sure. Well, my name is Chien Hung, and I am the program director at Voice. So I oversee a couple of different programs, and the two programs that are most helpful for most people. That would be the long-term care ombudsman program as well as the Voice Connect program.
Yeah, and those programs have both been around for a long time. So Voice has had the ombudsman program for the city of St. Louis since 1979.
Yes.
Is that right? Yeah. Mm-hmm. And recently we've grown, and that ombudsman role now we cover the entire eastern side of Missouri since now 2024.
Yes.
So we're really proud of that as well.
So a total of 39 counties now.
500 facilities.
Yes.
So a lot of work there. Mm-hmm. But so what got you interested in gerontology and long-term care advocacy? Like, how'd you end up here? Because this is an odd place to end up, just for all of us, I think.
That's true. So I am from Taiwan, and so unlike most people in our life, a lot of times we see our parents, the aging kind of older adults in our family, pretty often. So when you see your loved ones, your parents, your grandparents, frequently, every day, every couple of weeks, you don't actually feel they are aging rapidly. Or you don't feel that things changed rapidly. It's because every time it's just a tiny bit of change. In my case, I see them once a year. Therefore, this year, 2025, that I'm going back to Taiwan to see mom, I'm pretty sure I'm gonna see some stuff that I did not see in 2024, in 2023. So with this kind of once a year I see my mom, I see my family members, then I realize that hey, aging is a real thing. And now, 3 years ago, mom did not need help with any chores and walking. She was fine. But now she needed a little bit of assistance with chores, and then she cannot walk too long because her muscles hurt. And so all of those things that made me realize that hey, aging is real. And also, if I don't help people with people that are aging, then who is gonna help them, right?
Exactly. Yeah. Who's there? So how did you, you were a social worker. How did you make the jump from just normal social work to gerontology? Where did you come from? How did you end up at
Yeah.
Voice?
So the first 10 years of my career, I worked specifically with adults that lived with HIV/AIDS, that also lived with substance usage issues, and then homelessness and mental disorders. And they are all challenging kind of issues. Now, if you put all of them together, even more so, very challenging. So after 10 years of working with this population, then I realized that, hey, there is one population that I have not worked with, and that was an aging population. And that was also because back then, in the 80s or all the way till 90s, people died of HIV/AIDS. But then after 90s, after the cocktail therapy, then people don't die of AIDS anymore. So they live with AIDS. Then that means that the HIV/AIDS patients, they live longer. They get a chance to become older, just like all of us. And then at that time, my clients, my residents, they started aging, and some of my clients, my residents, they were in their 70s, they were in their 80s, and they were HIV/AIDS positive. So then with all of that, I started thinking about aging issues. And then I went back to school to get my second master's degree in gerontology. And then after that, I graduated, I got my degree, and then just happened that this position opened up, and then I took it.
Are you or a loved one exploring long-term care options? Finding the right support can be overwhelming, but it doesn't have to be. One call to Voice Connect Helpline, and you'll be connected with an expert who can help guide you through the process. Whether you're wondering about care levels, financing options like Medicare, Medicaid, veterans benefits, or paying out of pocket, or you need specific recommendations that match your needs, Voice Connect is here for you. We're more than just information. We're your partner in finding the right care. You're just one call away from peace of mind. Call 314-919-2403. That's 314-919-2403. So there's a question that we get around here a lot, and that is, what is an ombudsman? Can you go into that?
Sure. Actually, how do you pronounce that word first?
Yes. Yeah.
So it's ombudsman. So ombudsman. So ombudsman is actually a Swedish word, and it means advocacy. It means to advocate for people who cannot advocate for themselves. It means troubleshoot. It means to mediate between conflicting parties. It also means education, to provide education to people who are in need of resources, who are in need of information. That's what ombudsman is. And so in Missouri, the long-term care ombudsman program, it is specifically for residents that are in long-term care. And that means that the long-term care facilities that are licensed by Department of Health and Senior Services in Missouri, and that they are skilled nursing facilities, intermediate care facilities, assisted living facilities, and residential care facilities. These 4 levels. So as long as a resident that lives in skilled nursing, in intermediate care, in assisted living, in residential care, in Missouri, then ombudsman program, we have federally granted jurisdictions. We have federally granted powers that allow us to go in and to advocate for residents to resolve issues for them.
And so this is a federal program, so it's available in all 50 states,
Yes.
all of the United States territories. Basically, if a skilled nursing facility in your area is covered by CMS or is licensed by the state, an ombudsman can exist there.
Yes, that's correct. Except for it also, every state kind of defines long-term care a little bit differently. Our neighbor, Illinois, they actually include home health care as part of long-term care. So they have an ombudsman specifically for home health care. But in Missouri, we don't have that. We don't have jurisdictions over home health care. Therefore, our specific service area is facilities. So skilled nursing, intermediate care, assisted living, and residential care.
Okay, and that does not include like senior apartments, independent living, things like that.
Yeah, unfortunately, no.
We do get those calls.
Yes, and then adult daycare, we have a lot of calls for them. But we, unfortunately, if there's any issues, we don't have jurisdiction, we don't have powers to intervene. However, we earlier I mentioned that we have a different program, that's Voice Connect program. We do provide resources, options. If you are looking for adult daycare, if you are looking for in-home care services, then reach out to our Voice Connect program, and then we can provide you resources about those services.
Excellent. So we know that there is an ombudsman. We know they're there to advocate. First, who are they advocating for? The family of the resident, the facility, who are they advocating for?
Yeah, very good question. So now this program is federally designed as a resident-initiated program. Okay, so resident-initiated, that means that this program, the advocacy services, is for resident when a resident initiates it. So let's say, of course, if a resident calls in calls me, hey Chien, I hit this call light, and then they don't respond. They don't respond for 3 hours, and then I have to sit here waiting for them to come rescue me. Of course, that I can help. But then if it is not a resident that initiates the call, a family member, they call very upset, dad hit that call light, they don't come for 3 hours. Well, I can take the complaint. I cannot just start the investigation or start intervening just yet. I have to actually reach out to the resident, and for the resident to give me consent, I have to have residents' permission in order to start intervening. But that said, though, a lot of times, let's say if a resident is no longer their own decision maker, and our kind of lingo is called a responsible party. If a resident is no longer their own responsible party, that means that their doctor actually put on paper to say that they are incapacitated. They are not competent anymore to make decisions for themselves. Now their power of attorney has become active. They might have a guardian, and those individuals they can initiate an investigation with us. So in other words, without residents' consent, because a resident is no longer their own responsible party, but their active POA, their guardian, they can tell us about the complaint, the concerns they have, and then they can also give us agreement, give us permission for us to start a case.
So what are some ways that the ombudsman can help in a situation? I imagine there's a lot that goes on in nursing homes that people don't like, that residents don't like, that family members don't like. What things can they help on? And I guess on the other turn, what can they not help on?
Sure. So let's start with the issues that we often encounter. So in nursing homes, the issues we often encountered, well, that call light, they don't respond for 40 minutes. Well, the dinner is served to me. It's always cold. At least it's been cold for every night for 3 weeks. People are these nursing home staff. They are very rude. They yell at us. They are not respectful when we interact with them. Well, this nursing home does not have any activities, or the activities they have. I'm not interested. I want to go out. The nursing home goes, well, you cannot go out. It is too hot. It is too cold. Well, I need to smoke because I smoke in my own home. Now I move here and you tell me that I cannot smoke in my own room. I'm gonna smoke. Or, I did not pay rent. And then I thought Medicaid, takes care of the fee part, and then I spent all of my money. Now they're accusing me of I'm not paying my rent. They're gonna discharge me. They're gonna kick me out. What am I gonna do, right? So all of these issues we can help, and no matter that's about care, insufficient care, poor services, or services not I expected. Or like discharges, do I have the right to stay in the facility? Because not paying, that is not my fault, because apparently Medicaid should pay, and then that is actually a confusion there. Medicaid pays for someone to live in a nursing home, the person, the resident, they also have to pay themselves. But that's gonna be another episode. But we're not getting into that. But there is a way for us to help, as long as you call us. And for all of those issues, we certainly can help. However, we are not the sole entity in this kind of situation, because a lot of times issues are so huge, issues are so complicated. We also have to kind of ask our friend in the state office, that is what we usually call DRL, Division of Regulation and Licensure, and our friends, they are the state surveyors. We often have to work with them for them to actually come in to conduct the investigation with us. Yes.
So kind of thinking about maybe drilling down to one of those sorts of things. So let's talk about the food, because I am imagining if I have kind of pared down everything in my life and I'm now living in a single room, often with a roommate, I've gotten rid of almost all of my stuff, my car, they don't work anymore, had to get rid of my pets, had to get rid of my book collection, and all those sorts of things. Dinner is like the only thing that I'm looking forward to, and to say it's coming cold, it's coming bad every day. I can see where that would be a major complaint.
Oh, yeah.
When somebody complains about something like that to the ombudsman, what happens usually?
Sure. So, and then let's assume that the resident, Mary calls in about complaining about the food, right? And let's assume that Mary is her own responsible party, and Mary has already given us permission, a consent for us to intervene. Then we're gonna go in, and then we don't necessarily have to disclose Mary's name. We internally we know Mary files a complaint. However, we don't need to disclose, especially if Mary did not give us permission to disclose her own identity. So then we go in. This is just a regular ombudsman visit, which, by the way, if without any complaint, we have to visit nursing homes once every 3 months without any complaint. And then with complaint, of course, we visit more. Now, let's say we go in and then we can pick a lunchtime to go in, and then we walk around. We interview many residents, not just Mary, or maybe not even Mary, because Mary already filed her complaint. And then we verified that, oh, actually, there are more than just a few residents that have the same issues. The food is not good, the quantity no good, the quality no good, and it always comes in cold. And then along with that, then the servers, they are not very nice when they serve these plates to the table. And now we have an issue here, a verified issue. So every issue, every complaint has to go through this verification process. And then we can go to the facility, the big boss, supposedly that is the administrator. And then we talk with the administrator, hey, we have such and such complaint. And then what's going on with the food issue? And then after we receive the explanation, now our next step is then how can we make sure all of these issues, the temperature, the quantity, the quality, how can we make sure these issues don't happen again?
Excellent. So hopefully then they start getting hot food again.
Yes.
Yeah.
Nice.
And I imagine sometimes ombudsmen will face a little bit of pushback because they're dealing directly with facilities. Maybe they're getting pushback from families. What are some of the obstacles that ombudsmen typically face?
Well, so the first obstacle would be this is a resident-initiated program. And I explained what that is, right? Now, family and or just a concerned party, they saw this happen to their friends, their loved ones, and they come in to report this issues, their concerns. They've been very worried about their friend in the nursing home. But then we don't just immediately act on it. And then we tell them that, thank you for your report. We still need to reach out to the resident themselves in order to get this case started. And then people would get, kind of upset about it because, that's simply because, people didn't have enough understanding about this program, the resident-initiated program. But then other obstacles. For sure, let's say we go into facilities, and because of the facility staff change, then the staff don't know who we are, even though we just came here last month, and now it is an entire whole process of we are gonna have to reintroduce ourselves. We are gonna have to reintervene from the scratch in order to get these issues resolved. So, and then, and other than that, when we need to meet with the staff to get the issues resolved, the staff, they don't have time. And then they want to schedule a care plan, or they don't think this is the issue, because this issue, they never observe such an issue. The dinner is cold. No, dinner is always hot when they are served. So basically, that becomes a discrepancy of different aspects. So how to get that discrepancy kind of verified so that we can make sure moving forward, facility, let's work together to improve residents' quality of life.
It sounds like there's a lot of issues, and I'm wondering how many ombudsmen are there? Is it like one per facility?
I wish. So right now, I have a team of 6 ombudsmen. So we are talking about each ombudsman has to oversee about 6,000 to 8,000 beds.
Oof.
Wow.
That's a lot of beds.
That's a huge amount of beds. Now, from the federal standard from 20 something 30 years ago, one ombudsman should oversee 2,000 beds. Now, 20, 30 years later, it is one ombudsman in Missouri. It is one ombudsman for 6 to 8,000 beds.
So it sounds like we need a lot more ombudsmen.
Yes,
So
we do.
I'm going to guess we need a lot more money to do that.
Yes, we do. And in fact, we've been trying to ask for more money, and then we are not successful yet. But we every year we try to kind of coordinate to try to recruit more and more people, especially people in Jefferson City, for them to understand the ombudsman program and for them to actually support our program.
Yeah, and Voice has definitely been really active both at the federal level, trying to increase the funding for the ombudsman federally through the Older Americans Act, but also been really active here in Missouri, trying to increase the funding for ombudsmen throughout the state of Missouri. So not just money for Voice, but money for the whole program, because we're seeing the impact that it makes here in our area and throughout the state and throughout the country. So it's been really important. So if you're listening in near Missouri, definitely contact your legislators. Tell them that you really support additional funding for the ombudsman program, because, wow, I cannot imagine living in a nursing home without access to somebody who can speak up for me. I imagine retaliation is something that people are really scared of.
Mm-hmm. Yes, and because Mary is telling me that dinner is always cold, and then when I reach out, when I actually deal with the case, now there's another layer of issues. Then Mary is gonna go, well, what if they know that I made a complaint? Now, all the staff, including, of course, the cooks, the servers in the dining room, they are gonna be mad at me because apparently I blame them on not doing a good job working in a nursing home, serving the residents. So now there's one more layer of this issue, and that's retaliation. And retaliation is real, but it is also very, very hard to prove.
Yeah, I can see that for sure. I was just reading a report this morning where residents reported staff leaving their door open when they were bedbound, even though they asked them not to. Things like that. Can you say that was retaliation? Maybe, but was it a mistake?
Yeah.
What level do these things come to? And so that's the really hard thing for residents to speak up sometimes, is you just don't really know, especially when you have problems with the staff member.
Exactly. So we are just gonna have to be patiently work together with residents, with the staff, professionals in nursing homes, or maybe even professionals in the community, so that we will see if we could improve residents' life by working together.
So what's one thing you want people to remember about the Ombudsman program?
Well, even though the Ombudsman program has been in Missouri since 1979. It's over 40 years, actually 46 years now. Lots of people don't know about our program. Lots of people don't know about help is right here. So, just help us spread our names out there. Let people know that we are available to help. And then also call your legislators and let them know that we need more money.
We're looking for nursing home residents and family members with stories to share. We need your help to participate in the Missouri state legislative process by voicing your concerns or support on various bills. No experience is necessary, because we're going to support you every step of the way with resources and information. To find out more about the Missouri Alliance for Long-Term Care Reform, visit voicestl.org/alliance.
And one thing we talk about a lot around here is how the aging population is only growing right now. The largest generation in America is the boomers, and they are all nearing retirement and getting older. And so the need for advocates, for ombudsmen, for long-term care is only going to continue to grow in the next 10 to 20 years.
Yes, and in America, every day, 10,000 people turn 65, which is federally defined as old age. So every day we have 10,000 more individuals that become old.
Yeah.
Yeah.
That's a lot. And, the closer I get to 65, that just doesn't seem to be old yet.
No,
But,
no, it's not.
that's what the definition is. But, we see a lot of people in nursing homes that are under that age.
Yes.
And, certainly plenty of people that are over that age. So you did mention volunteers.
Yes.
How do people volunteer to be an ombudsman really anywhere?
Yes. So reach out to us, and then we will help you figure out if ombudsman is the right volunteer gig for you. Because a lot of times people think, oh, well, we have a good heart. We want to help people in nursing homes. But then once you actually visit nursing homes, you see those vulnerable kind of older adults. Then you kind of realize that this might not be what I want to do. So we will help you figure out. And there is a 36-hour training, which is a lot, I understand.
But it's with you, so it's really good.
Yes, I hope. I hope people think that way. So 36-hour training, 10 hours being shadow visits. Now, 26 hours of training, watching videos, talking, and then interactions with the peers, all kinds of training to learn a whole lot about aging, about long-term care. And then after those 36 hours, now before you even get certified by the state of Missouri as a representative that can visit nursing homes as an ombudsman, then 36 hours you can actually figure out if this is the job for you.
Excellent.
Yes.
Well, thank you so much, Chien, for being here today.
You're welcome.
Once again, I'm Marjorie.
And I'm Melody.
And we're at the Age.
Yeah. Thank you.
Are you looking to connect with a community of listeners who understand the unique challenges of caregiving? We want to partner with you. By sponsoring We're at the Age, you'll connect with a dedicated audience of listeners and help make a real difference for those managing the challenges of elder care. So if you're looking to reach an engaged audience, We're at the Age is the perfect fit for your sponsorship. Reach out today and learn more about sponsoring an episode or a whole season. Visit voicestl.org/podcast.